Ladies, take
So
it
we
away.
okay. All right, we are ready. So, hi everyone. My name is Jocelyn Okra. I'm the Director of Community Strategy at Cradle Cincinnati, and I have my colleague alongside with me, Danielle.
Yes, my name is Danielle Bush, and I am the Senior Media and Communication Strategist here at Cradle Cincinnati. So it's a pleasure to be here today.
Awesome. So I'm going to pull up our slide deck so that we can share with you all about Mama Certified. It's a new initiative that we have uplifted here in Cincinnati. It's very dynamic. We put it in place to support Black women and families here in Cincinnati. And so very grateful for this opportunity to share our work. All righty.
Okay, so we can get started with our presentation. So you can go to the next slide. Okay, so just starting off with a little background about what Mama Certified is. The official definition of Mama Certified is a national pilot and collaborative project in response to a call from mothers in Hamilton County for a solution that will provide them with information they need to make informed decisions about where they seek maternal care. So our purpose, we heard from Black birthing people in our community who were not satisfied with how they were treated in their birthing journey. And so they told us that they felt unseen, unheard, and unsupported by a system that tells them to be quiet and trust. They felt alone and they felt fear. So in a response to that, we created such a unique initiative to support Black women when they are choosing where they are giving birth in the city of Cincinnati and Hamilton County. Why we exist. So the facts support what patients have identified they were feeling to us. So Black moms are 2.5 times more likely to die from childbirth than their white peers. And in Hamilton County specifically, Black infant mortality continues to be far greater than any other racial and ethnic groups. And so based on those facts, we wanted to support Black women so that they can feel seen and feel heard and be at ease when they have babies at the birthing hospitals here in Hamilton County. So these are our partners for this project. It's a collective impact approach to maternal and infant health equity. So it brings all together the birthing hospitals in Greater Cincinnati to address maternal equity. This is a collective impact work. One organization is not responsible for our birth outcomes. So as we come together, we are stronger and we can make change with people who are on the same journey to having maternal equity, to address maternal equity. Sorry, I'm not saying next slide, but you just feel that it's the next slide. Sorry, Jocelyn. I'll say next slide. Why trust us? So we have created something for Black women, and it was created by Black women. Historically, when things are decided for Black people and Black women specifically, they don't have a seat at the table. And so we want to ensure that they are curating things to benefit them, but also having them at the table making those decisions. And so Women from Queens Village, for those who don't know, Queens Village is a supportive community of powerful Black women who come together to rest, relax, and repower, to take care of themselves and each other. And Queens Village is an initiative of Cradle Cincinnati, which is an organization that fights high infant mortality rates. And now we are addressing maternal mortality rates in this sense with the project that we're speaking about today. Next slide. So here's our theory of change. We want to address these issues using this theory of change. So we want to improve hospitals' respond to feedback and improve their practice and monitor disparities, communicate, badging and pathways are shared with the public so people are digesting the data that we're giving, and implementation. So hospitals are going to listen and co-create interventions. Listen to the community advisory board members Then we mobilize and strategize based off of all the information that is given to us from the data that we collect from the instances that Black women will report, which Jocelyn will get into a little later. We can go to the goals. Okay, so our project goals are, we have 5, are to increase transparency and accountability for clinical measures related to infant and maternal health, enhance a shared vision of health for Black moms and babies in the region. 3, to improve communications between Black moms and local hospital systems. Increase autonomy and decision-making and satisfaction during maternity care for Black moms, and demonstrate progress as a region and by hospital towards equitable clinical practices for maternal and infant measures. And our key focus areas are infant care, maternal care, staff care, and community care. And Jocelyn will also talk a little bit more about those focus areas and badging. Next slide.
Okay. Yeah. Thank you, friend. Okay, so I'm going to talk about the pathways to certification, and this is where Mama Certified tends to get a little complicated. So please, if there are questions at the end of the presentation, please hold them, and we will be sure to answer as many as we can. So the hospital systems that are choosing to engage with Mama Certified are choosing to engage in a certification process. And so these hospitals are going to be reviewed annually on their efforts in 4 focus areas: infant care, maternal care, staff care, and community care, as Danielle already shared. In the first year of implementation of Mama Certified, and so the year that we are in now, we uplifted the infant care and the maternal care focus areas. The next area that we'll be focused on is community care, and then staff care is kind of happening throughout. The pathway to certification for the hospital starts with reviewing and defining the methodology. And so there are meetings that are had with our Queens Village advisory boards. Our Queens Village advisory boards are made up of Black women, Black mothers in Hamilton County, and with the hospital systems to review and update the metrics, to the definitions, the certification, and the scorings. And then based on the feedback that we have from the advisory boards and the hospitals, those pieces of the work or pieces of the methodology are refined. Then each hospital has to make a commitment each month to participating in Mama Certified. So our big win for this upcoming year will be having our hospital systems that participated in the first year recommitting again to participation. Then there will be a data and pathway submission. So each of the hospitals are going to submit the data based on the focus areas that we have for the year. So again, right now we got data on infant and maternal care. Upcoming, we'll be getting data on other focus areas as well. Then there's the member data and review, where the hospitals provide feedback and their revisions to the scorecards in their reports. And then lastly, there's the certification involves the badging that they receive, which I will talk about in a couple slides based on what we receive for each of the focus areas. And then there's a sharing with our community. And then throughout all of this certification is the engagement that is happening with the hospital systems and with Queens Village. And so this is happening by the hospitals engaging in training, the staff engaging in training. It also, the hospitals were given an opportunity to uplift a Queens Village board within their system. And so 4 hospitals made that choice. And so every 3 months, there is a meeting that is happening with these hospital systems that made the choice, that keep the 2 pieces, the hospitals and the community, constantly engaged and working together. And so each of these hospitals are reviewed annually on the 4 focus areas. And I'm going to talk a little bit about how each of these focus areas, how they break down and what is included in them. And what I also want to mention is that we really wanted to make sure that we were working in partnership with our hospital system, that we were giving them a task that they could meet. And so many of the criteria within the badging or within the focus area, we're asking for data that they are already providing in some way already. So we're asking for data that they're already providing to the Joint Commission. We're asking for data that they're already providing to Birthing Friendly Hospitals Initiative. And so again, because we didn't want to make this a list that they weren't able to meet. And so within the infant care focus area, we're asking questions that may include issues around safe sleep, breastfeeding support, identifying and addressing infant health disparities, and then also unexpected complications in term newborns. For the maternal care badge, we are again identifying and addressing maternal health disparities. We're asking questions about cesarean birth. We're asking questions about smoking cessation support, about postpartum mental health, postpartum family planning, and patient, which is really important, patient satisfaction. For our community care badge, which again, this is a badge that we haven't hasn't been initiated in our community yet, but is forthcoming. We're going to be asking questions. There's going to be questions related to the social determinants of health, the referral processes for the social drivers of health. We're going to be asking about what type of partnerships the hospital has that can meet some of these needs that our families have. And then we're also going to be asking about their engagement and what their selection process is for their community partners. So have they engaged partners that are really beneficial to the community that they are serving? And then for engagement, we want to see from the hospitals like a promotion of Mama Certified. Do you have are when women walk into your establishment, is it evident that you are a Mama Certified hospital, that you're participating in this initiative? Do you have staff who are trained in Mama Certified and understand what the initiative does? Again, have you participated or uplifted a Queens Village advisory board? Are you participating in the food feedback loop? And that's something that I'm going to talk about in a couple of slides. Have you committed to a pathway to improvement within the pathways that were identified needed additional support? As a part of the certification process, each of the hospitals are eligible for a badge. And I'm going to talk a little bit more about that. We are hoping or wanting each of our hospital systems, when they do receive a badge, to prominently display it so that everyday mothers walking into the establishment are aware right away at what this hospital, where it ranks, or what's what step it is, or where it ranks within the different focus areas that we are focused on. So, if a hospital system can either get an ally um, badge, it can have an advocate badge or a leader badge. And so what the ally badge means that this hospital system has gotten 50% of the available points. What the advocate badge means that they have received 70% of the available points. And then the leadership badge means that 90% of the available points that they can receive within this badge has been received by this hospital system. And what's also important to know is that they they that the badge is based on the focus area. So a hospital system can get an ally badge in one area, a leader badge in another, an advocate badge in something else. You don't get a badge across focus areas. Each badge is very specific to the focus area that's being uplifted at that time. The certification also produces a report because, as Danielle mentioned earlier, what is really critical about Mama Certified is we're trying to ensure that our community members are aware of what hospital systems are doing in order to address poor outcomes and racial disparity within these hospital systems. And so a very thick report is created each year, but then we also have a report that is high level and easy to read and understand and easily accessible to our families, to our mothers, so that when a mother is pregnant with when a family is about to have a baby, they can go on our Mama Certified site, which is mamacertified.org, and very quickly determine which of the hospital systems in our county are delivering on the items that are most important to them. So if we have a family that is very interested in maybe safe sleep and infant care, then that family potentially would choose a hospital system that has a leader badge when it comes to infant care. The hospitals that are engaged with Mama Certified are also committing to being a part of a feedback loop. And so the feedback loop is really honing in on what type of experiences are our Black mothers having within this hospital system when they are pregnant and when they are delivering and into the postpartum period. And so how the feedback loop starts with the birthing experience survey, and we are actually in the midst of collecting data and information for that right now. And so Black mothers who have given birth within the last year within Hamilton County, they are able to complete a survey, which I will share a little bit more information about at the end of the slide deck, but they're able to share information about how they were treated, what they appreciated about their experience, where there were opportunities for improvement with their experience. We are going to be collecting data about that until the end of September of this year. What will be happening next is some provider and patient interviews. So we have an independent researcher who's going to be conducting interviews with patients and providers so that we can further understand the perceptions of the care of Black women and birthing people. We're going to go into a data analysis period where we are crunching the numbers, crunching the data, receiving the stories that we've gotten through this data collection period, both with the survey and with the interviews. Then we're going to activate the QV Habs. So again, the QV Habs are the hospital advisory boards that are made up of Black women who have been patients, either currently or previously, but also made up of hospital leaders within these hospitals that have chosen to uplift these boards, and they're going to work together and use the information to determine where it is they should focus their attention. And then they're going to end in like activating some type of intervention based on where we learned through the data collection period. These hospitals should focus their attention. We're going to kick it back to you.
Yeah, so here are some key takeaways that well, we know there's a lot of information, so we'll round it up and talk about some key takeaways. Next slide. So as Jocelyn stated earlier, next slide. Jocelyn, next slide. Thank you. Appreciate it. So the website, she spoke about the website, the things that you can do on the website. We intentionally, chose the certain logo and colors. We know that in marketing, colors evoke certain emotions. So we wanted it to be warm and welcoming and caring for Black women to come on our website to utilize it for its sole purpose. We have videos on there explaining the hospital certification process. And we want them to use this to find the best place for them to have a baby at their own discretion. And this also is the hub for our birthing experience survey that we've been motivating folks who have had a baby in the last year to take so that we can add to that data and use it accordingly. Next slide. So in medical spaces, oh, sorry, I think that, did we skip that? Okay, yeah. We have been providing medical spaces with the materials that they need. So signage, they will be displaying mama certified signs and materials. These are a beacon to patients, letting them know that the organization that they have chosen to have a baby at is trying to do better and they are in a safe space. It means that the leadership of the hospital cares about the issue and they are undertaking this journey towards more equitable outcomes by being willing to share data, willing to accept feedback, and invest in their staff and their community. And it also means that the healthcare workers there have taken the training and are holding space for Mama Certified in their areas in which they work, and that it will be a reflection in how they treat patients when they come in. So it is physical and digital as far as Mama Certified being in medical spaces, displaying to the patients that come to there for care. We're also in the community. Brand awareness starts out in the community. So we have printed flyers, we're printing t-shirts and stickers, and we also direct people to the website. And we also have a robust marketing campaign where Mom Certified billboards are placed strategically around our city so that people can be aware of this new initiative and utilize it to its full potential and for its intent. Next slide. I think this is your slide.
Yes, ma'am.
Okay.
Can you please?
Sorry, I'm moving too slow. Sorry.
Thank you. Okay, and so what have we achieved so far since our implementation of Mama Certified? We have four hospital systems that have committed to Mama Certified and are achieving badges in maternal and infant care across 7 individual hospital facilities. We have 1,000 perinatal and women's health employees who are trained in Mama Certified. That shows a huge commitment from the hospital system to walk in lockstep with us to achieve these equitable outcomes for the Black women in our county. We have 4 Queens Village Hospital Advisory Boards with 32 hospital and community member participants. And then we have 16 badges in infant and maternal focus areas that have been awarded to the hospital systems in our county. And so what can you do? You can help increase awareness of Mama Certified. As we have said a couple times, this was a program that was initiated because the Black women in our community really stated that they wanted to be more aware about what is going on within the hospital systems in Hamilton County. And so they have to we now that we've built this program, we really need to make sure that they know that it is a tool that they can use here in Hamilton County. And so please tell folks about it. There's all materials can be ordered for Mama Certified if you would like to have some of the materials that Danielle showed earlier. And then really if you are living in Hamilton County and also Butler County, please encourage women who have recently given birth to complete the birthing experience survey. As many women as possible willing to share their experience, that means that we can focus in on exactly the area that needs to be focused on and work with the hospital system to determine some type of solution for our families. And then we are open for questions. So I'm going to pull down the slides so that we can see each other. But would love to answer any questions that folks may have.
I'm just jumping in really quick. First, thank you so much for being here today with us, Jocelyn and Danielle. Wonderful presentation, super important information to get out to the community and to everyone that's on this call. Just so everyone knows, because it's a webinar style Zoom call, you have to type in your actual questions into the Q&A, and that should be available to you all. Like if you're on a computer, it's like at the bottom of your screen. If you're on a phone, it's right at the top of your screen. So if you have questions, please feel free to drop those in the Q&A. I can read those off for the group, and then Danielle and Jocelyn, if you all want to answer those. I do have one question that I see right now that I'll go ahead and start with. This is from Sierra Johnson. She says they're a reporter from the NBC station in Columbus. Their question is, is there any communication to take the program beyond Hamilton County? And are there any plans to implement this at a state level? And can you discuss if you've had any interest from other states or Central Ohio stakeholders about this? So kind of a three-part question there.
Yes to all of it. So we have begun talking about how we may be able to spread something, not quite Mama certified, but that has a lot of the goals of Mama certified in Ohio. There's also been some conversations because we presented Mama certified at a national conference in Chicago about a month or so ago, and there's been interest from people who heard the presentation about seeing how we could implement it there. But what I also want to share is that Mama Certified is an initiative that is in its pilot stage. And so it's really important to us that before we're like trying to spread it other places, we know for sure that we have a model that is working here.
I think it's important to note too that there are some programs that Queens Village and Cradle Cincinnati, or Cradle Cincinnati through Queens Village, have implemented in other parts of Ohio. And so we want to make sure that we clarify what that is. It may not be Mama certified, but there are other programs that have been spread across Ohio because there were grant dollars to do that. Because the importance of what we're doing here in Ohio when we're passing laws is to make sure that we're impacting all of our constituents across the entire state, just like Senator Hicks Hudson is in Toledo, in the Toledo area. We're looking at Cuyahoga County and all of the rest of and Franklin County also. So this may not be something that we're sharing right now and doing all over the state of Ohio, but there are some other things that you're doing. You might want to differentiate what those are.
Yes, thank you for that, Senator Ingram. So yes, Queens, although Mama Certified has not spread across the Cincinnati or across Ohio, Queens Village has. And so Queens Village is uplifted within 9 different communities here in Ohio. We're in Columbus, we're in Cleveland. Help me out, Danielle. We're in Butler County, we're in
in Tulsa. And we're talking about Ohio. Sorry, I just start firing off.
Toledo, right. You have some other area, Franklin County, they're also there.
Yes. So we're in 9 different locations here in Ohio. And so that when you have a Queens Village, that means that you do have a group of people who are focused on Black women and Black babies within that community. And they're focused on that by targeting Black women, providing them with opportunities for rest, relaxation, and an opportunity to build community. They're also focused on shoring up Black women's leadership, ensuring that medical, political communities are listening to the experiences of Black women, and they're also focused on shifting the narrative. So, but that piece of our work is
Thank you so much. And I really appreciate that response to the question. I think that did a good job hitting all the points of that question. Queens Village and Cradle Cincinnati, their impact goes beyond. And then with the Mama Certified being in its pilot stages and seeing that it would expand. There is a few other questions here and comments. The next one I will go to, it's Chuck Watts, and he is the founder and CEO of Empathy Surplus Network, basically reaching out and saying that they're a member of the United Nations Global Compact. It's a voluntary business initiative to align operations around human rights. And if you all were interested in engaging with members of that organization to promote this empathy within your particular mission of the Mama Certified. So maybe that could be something where we could get you all contacted, maybe connected with them. So that's just kind of I guess more of a comment, but I can maybe work on my end and get you connected with that individual. And Chuck Watts, if you're able, I'll just shout that out right now. If you're able to email um, my email or State Senator Catherine Ingram's email. We can definitely get you connected. The next person is Director Dawson of the Ohio Commission on Minority Health. She is just giving a shout out and thanking you all for the commitment to develop a strategy to address these longstanding health disparities, and that the Commission on Minority Health would gladly share this information. Again, I can get you all connected to make sure that that information is getting out there. This is a question that we have from Michelle Bullock, or Michael Bullock, maybe. They are Dr. Michael Bullock, President Miles Mission in Zanesville, Ohio. And the question is there any discussion on future opportunities to collaborate with other Ohio organizations implementing measures to help families and women of pregnancy and infant loss and the care for mothers after loss?
That isn't a discussion that we've had yet with organizations across Ohio. We have done a couple of things within our county to support mothers after loss. However, I think that this could be another situation where, Deja, if you could be supportive in sharing my contact information, and we could see if we can have a discussion moving forward.
Yeah, I certainly can do that. Let's see, we got another.
Just maybe we could share, I'm sorry to butt in, but maybe we can share everybody's information who's signed on to the call that wants that information to be shared, because there are folks, we're doing all kinds of fabulous things all over Ohio. I know in Cuyahoga County, we have Birthing Beautiful Babies, we have Rosemary's Babies, we have all kinds of things that are going on. And the interesting thing about that is that, say, doulas, and we did some things with the Medicaid budget and things like that, but we have to look at doulas as far as they're there for birth, and they're also there for that empathy that goes along with if indeed that mother has lost a child, and should be trained to do so. So those are things that we need to shore up, and you guys need to tell us, should there be, like I'm listening regarding the certification to be mama certified, but then the hospitals have to have a certification also. So the question becomes, should everybody have some sort of certification? And what does that look like? And I know we're having that conversation now with the nursing folks, but help me with what that looks like. But I'm hoping that everybody would look at this as if you don't have the mama certified right now, but you're looking at and thinking, how does that come to Cuyahoga County? How does that get to Summit County? How does that get to Zanesville? And so how do we engage, and how do we make sure that that's happening all over the state? Sorry about that.
No, you're totally fine, Senator. I think that what you said is very important, and I'm just looking through our Q&A. Just another connection as well. Again, on my end, I can work with you all with the Ohio Legislative Black Caucus, getting you connected. And I see that people are sharing their information. Thank you so much. And then Director Dawson said as well that she would be glad to inject to ensure that you're aware of our conference grants to elevate this work. Again, I can definitely work on my end to get all of the folks reaching out in the Q&A right now to get you all connected with them. From what I'm looking, oh, here we have another question from Ashley White. And she says, thank you so much for the information. And what can we do to better support your efforts? And what can we do to get moms certified in Cuyahoga County? I know we kind of just touched on that. And they do have, like, you know, the Village of Healing, and like Senator Ingram mentioned as well, Birthing Beautiful Communities. And then she goes on to say, you know, the percentage of infant deaths have been going down, but obviously we want to get that number to 0. So I know you all touched on this, kind of expanding it across the state. I don't know if you have any more comment on that.
No, I think that, like, it definitely starts with a conversation. So I'm excited for folks who are interested in connecting with me, reaching out to me and scheduling a conversation for us to talk about what next steps could look like when we are ready to spread Mama Certified.
Let me ask this question too. Do you think it would be helpful in those areas? Of course, we're talking about Hamilton County and Cincinnati. But do you think it would be helpful in those areas, in the rest of the state, in Summit County, for instance, or Montgomery County, for those organizations who are already providers or are already working in that space in those areas? Would it be important for them to start keeping information? Because now, right now, they're not keeping any of that information that you're going to looking for eventually, that the hospitals already report. Would it be helpful for them to try and gather some of that information early, or start to work with you or work with somebody to be able to know how to get that information, despite the fact that they're not using the data right now?
Yes, I think that so we spoke really briefly about collective impact. But I think that we didn't really talk about how important collective impact has been to this work, Mama Certified, because I don't think that we would have been able to lift Mama Certified without the 11 years that we have previous and here in Hamilton County, where we have been working very closely with hospital systems from the beginning. It was a very tough conversation that we had with hospitals to get them to open up their data and share with us and also share with the community. Like when we first started talking about Mama Certified, people said that it wasn't going to happen. And so a starting point place that I would think is to start developing your relationships and developing that coalition and that partnership with hospital systems. So if down or when down the line you are wanting to have an ask like that, as great as the ask as we have asked our hospitals for in Hamilton County, there's a relationship built and some trust built so that you all both know that everyone means well. That's where I would start.
I think that's good. That's a good point, to start building those relationships, because we're all in this together. It's like right now I do have an issue with some of the birthing centers who want to be able to do C-sections, but they have to have a relationship with the hospital in order to do this. And this is all, I don't want to get muddy in the water with any of that, but it's kind of, well, no, you can't do that unless you have. And so these are the kind of conversations that need to start to happen, if they haven't already happened, to have those relationships already built, as to we're working together and not we're just trying to do it instead of you. Thanks.
Yeah, and just to jump in, I'm just checking the Q&A. We're getting some more questions in here. Let me see here. So this question, I mean, granted, it's relevant to our conversation today. I don't know if who wants to maybe answer this, or if this is more of like a follow-up conversation. This person is asking about IVF coverage mandate in Ohio, and given what we know about like the health disparities in access to IVF, sorry, and in the improved outcomes with improved IVF access. Is that, I don't know if that's something that we can cover today, or if this is any in your conversations as you're doing like this kind of work, or if that's something maybe we'll follow up on.
Yeah, I definitely think it's something that we should follow up on. It hasn't been an area that we focused a lot of attention on so far. However, we do recognize that there are a lot of issues with infertility within our community. And so it's not to say that this would never be an interest of ours.
Okay, thank you so much for that. And I'm going to go ahead and go to the next question. Thank you everyone for submitting your questions. We have quite a good amount here. Let's see. So Suzanne Ackerman in the chat says that the work you're doing is really great and congratulations, having this program up and running. And the question is, have you had any conversations with Ohio Medicaid, so Ohio Department of Medicaid, on how they can support you further in this work? And I know Senator Ingram touched briefly on recently doulas have been in the process. The law was changed where the doulas are getting reimbursed through Medicaid for providing their services. But on your end, if there's been any involvement with you all in the Department of Medicaid?
Yes, actually, ODM has been a long supporter of Queens Village almost since the beginning of Queens Village in 2019, and we actually have a site visit planned with ODM, I think on August 13th. So, guys, wish us luck.
That's wonderful. And then let's see, I think there may be
Uh,
one.
Let me say this while you're looking for the next question, Deja, is that that has to be a conversation too as to what that actually looks like, what that reimbursement would look like, how we need to think through what that really is, because that's part of the issue too that folks have is that, well, Medicaid may not reimburse, or they they reimburse at such a lousy rate, or and those are the conversations here again with the certification, who does what with whom. It really makes a difference. And so we want to make sure that here at the state level, we're talking about the budget and those policies, that we're putting things in place that'll be beneficial, and here again to eliminate some of that struggle that's been happening over the years with the uh, who's in charge kind of mentality.
Mhm. So one of our last questions, I believe, here is, excuse me, it says, how have you gotten families to engage with your organization and tell their stories? I know you've mentioned some of the ways that, you're marketing for the program and how to get people engaged, but kind of what that has been like looking like for you all to get people more engaged to tell their stories.
Um, I honestly feel that it stemmed from how we created Queens Village, and that started with being authentic and building trust within our communities and within our neighborhoods and just within Black women. And honestly, people have been sharing their stories with us far longer than Mama Certified has been in existence. And that just comes from loving on Black women, welcoming Black women, and creating safe spaces for them to share and process their trauma. And it happens naturally. We also practice story shares. So we will do that in the Learning Collaborative, where we share stories, where families can share their stories amongst medical health professionals, city officials, and different things like that. And so I honestly believe that it came from trust building by launching Queens Village first, and then Mama Certified kind of just, makes that comfortable for people to share their story. People share their stories with us via Instagram and Facebook inbox, and they just feel comfortable because they know that we're going to advocate for Black women and make sure that we amplify their voices.
And let me say this before we go. It's important for us to make sure that we recognize too the fact that we are focusing here on Black maternal health, and the infant mortality, of course, was for Black babies is much worse than it is for our white counterparts. But the reality is that once you make it better in the system for Black women and create that or eliminate some of that disparity, then we're making it better for everyone. So it's not about just we're focusing on this, because I don't want us to get into the whole conversation that unfortunately I've been hearing here lately, since it's election time, that it's we're not trying to separate, we're trying to make sure that we have equity. And despite the fact that people don't want to talk about that, it's important.
Yes, thank you so much, Senator. And as I'm looking through the comment or the question and answer box, I don't believe I'm seeing any new questions. But if people still do have additional questions, they're more than welcome to reach out to my email or the senator's email, or after this meeting, we can definitely follow up if you still have remaining questions. So I think as of right now, I think we're good. I mean, thank you again, Jocelyn and Danielle. This has been so wonderful. So happy to have the Black Maternal Health Caucus have a meeting again, and wonderful to have you all be here to do that with us. So I will be sending out follow-up information to all of our to all the attendees. And We also record our meetings, so you'll be able to see a recording of this meeting if you would like. We also do have an older meeting that we did with Cradle Cincinnati Queens Village, talking about their other program, their other initiatives that they have that are statewide that we briefly talked about today. So I can certainly even send the link to that video so folks can get some more background information on that.
To get some of that on the website too, because the Black Maternal Health Caucus does have a website, and even some of our older interactions, we were talking with things on folks on a national level, they'll be able to get that. But this is about us trying to take care of our Ohio people, and it's important for us to not shy away from trying to make sure that we say up front, this is what we need, legislators. And I don't mind you telling me, because we've got a lot of work to do.
Exactly. Well, and if you all don't have anything else you would like to share before we go, feel free. Again, thank you so much for being here today.
I think we could just express our gratitude. Thank you so much for giving us the platform to share the work that we're doing down here in Cincinnati. We really appreciate it. Thank you.
And also follow us on Facebook and Instagram to keep up with the things that we're doing. And you'll also see Mama Certified on Instagram and Facebook. So to keep up and stay, in the thick of it, just follow us and we'll be posting things as we go. Thank you.
Thank you, everyone. Have a good rest of your Thursday. Thanks for joining us.